It causes you to gain weight, but not in like a magical fat forming way, in a way that makes it so that you're just hungrier, basically. Just like when people say that depression medication causes weight gain, and it's like, no, the depression medication does not cause fat gain. If that was the case, they'd be prescribing Lexapro to like starving people in third world countries. Good morrow, everybody. My name is Robin, also known as SunnySideUpGal, and you are my Sunny Side Up pal. Good morning, good morrow, and good day. If you are new here, thank you so much for stopping by my channel. Please consider giving me a subscribe and like the video, because I know you're gonna like this video. If you are not new here, thank you so much for returning. If you're returning and you still haven't subscribed, why? Pourquoi? Please subscribe. Today's episode, we're just going to go ahead and jump right into some things. We're going to finally address the name change of the notorious PCOS, polycystic ovarian syndrome, to polyendocrine or endocrine, depending on where you're from in the world. Polyendocrine metabolic ovarian syndrome. We're going to chit, we're going to chat. We are going to talk some trash, because there's going to be some people that we're going to be watching some reels. We're going to chit, we're going to chat, we're going to learn about PCOS, Pmos, its impact on weight and weight loss. And we're also going to talk a little bit of trash.
I love trash.
And sit and kick our feet and giggle like little girls.
Ryan.
So if you're unfamiliar, I have had PMOS for many a year. I got diagnosed with PMOS when I was 26 or 27, one of those. What had happened was I had a crazy bout of just, and this has happened multiple times, so if you have been following me for a while, you know the lore. I've been having I had bleeding issues for a long time. When we lived in Tucson, I had such a crazy bout of bleeding, and I was so stubborn. I didn't go to the emergency room or the doctor for such a long time. I ended up having to get a blood transfusion. Like, me almost died. I had to get a blood transfusion, and then they like found out that it was my uterus was like constantly shedding its lining, and it was making me sick. So I went to a gynecologist and was diagnosed with PCOS and was just prescribed metformin, but nobody ever told me about like how diet can affect it or like what makes it worse. I was just basically told this is something that happens to women, and it's just a for life thing, and it's pain and symptom management. I didn't really get a lot of pain from it, like I guess when cysts would burst, but I'm so used to it now that it's just like crampy. But anyway, I dealt with that for a little bit, and didn't, for a couple of years I just kept gaining weight from it. And then I found the ketogenic diet, and I've been like on and off the ketogenic diet since 2018, and have maintained a 40-pound weight loss for quite some time. So the biggest thing, if you're familiar, if you're a PCOS girly or person and you're familiar with PCOS, you understand the difficulty that comes with weight loss and PCOS. So if you don't know why or what causes that, why it's so hard to lose weight with PCOS, it is because it causes your body to have it's like a hormonal shitstorm. It causes PCOS, PMOS. I'm going to be using them interchangeably. I'm still stuck on PCOS. It causes insulin resistance, and when you are resistant to insulin and you eat carbs, your body will just be in storage mode. Now, if you're like, carbs aren't bad, sure, carbs aren't bad. I'm not saying carbs aren't bad. I'm a low carb baddie. Carbs are not bad, but if you are in a constant state of like, my body is resistant to insulin, anytime I eat something that pumps out insulin, I'm going to get fat, then yeah, they're not good for you. So when you live in a society that has these, and I'll put the guidelines up, that has these dietary guidelines that tell you that you should have at least 230 grams of carbohydrates a day, you're going to be stuck on that. There's a lack of nutrition, and there's a lack of nuanced nutrition advice or nutrition dietary guidelines in our society. So we have this like standard dietary guideline that the government has put out. I'm going to say the government. It's like they want you to eat real food, nutrient dense food, but there still is like a guide, like a targeted carbohydrate intake. There's no like, I keep wanting to say nuance. There's no like separation. So there's no like, this is for somebody, this is the dietary guideline for somebody who's an athlete. This is the dietary guideline for somebody who has PCOS. Like, I mean, you can go onto you have to be willing to advocate for yourself. So if you get a PCOS diagnosis and you're like, how should I treat this? And your doctor's not a dietitian, so he or she is not going to tell you you should eat low carb. You have to kind of like find a community online, which is what I did, and figure out what works best for your body. But you have to do the research on your own. And I'm not saying that people are stupid, but some people just don't care to do that. They still are like, I'm just going to eat whatever I want still. There's a pill out there somewhere for me, even though I was on metformin for like 8 years, and like metformin is great at preventing you at slowing down diabetes and like treating if you already have diabetes, helps with your blood sugar. But like I still had pre-diabetes or insulin resistance for the amount of time that I was still on it. It wasn't until I started locking in again in 2026 and really, really locking in and like focusing on running off of ketones and not glucose that I was able to get off metformin and reverse my insulin resistance, all in like a matter of like 6 months of just really, really locking in. So it's very, very possible to reduce insulin resistance with diet. But anyway, regardless, let's learn about PCOS a little bit. Let's read the definition so everybody has a little bit of what is PCOS. If you are not interested in learning about like the really brief rundown of PMOS or PCOS, jump to this timestamp and let's enjoy. Okay. So I am on the Mayo Clinic website. I'm on the Mayo Clinic website. We're just gonna skim through PMOS. I'm gonna go over some of my findings with my personal body, and then we'll get into the reels and chit and chat and giggle. Okay. So polyendocrine metabolic ovarian syndrome overview. Polyendocrine metabolic ovarian syndrome is a hormone health issue that starts to show signs in women or females of childbearing age. Polyendocrine metabolic ovarian syndrome (PMOS) is a hormone health issue that starts to show signs of women of childbearing age. Polyendocrine metabolic syndrome used to be called polycystic ovarian syndrome, PCOS. If you have PMOS, you may not have periods often, or you may have periods that may last days. You may also have male pattern hair growth called hirsutism, which happens when you have too much of a group of hormones called androgens in your body. PMOS is driven by effects of androgen and changes how your body uses a hormone called insulin, which controls blood sugar. So it is a insulin fuckhead. It causes so much problems with insulin and hormones in your body, and it's just an imbalance thing. So we're gonna see some people in these reels today that have hirsutism, and in my opinion, they are addicted to carbohydrates. And it's like if only somebody was out there that told them like, hey, if you would just cut your sugar in half, this might like fix that. I don't know if any of you have had I never got hirsutism. I literally got the bare minimum. I almost thought that I was misdiagnosed with PCOS because I didn't get the like string of pearls. I'll put a picture up, but like a lot of people with PCOS, they get the string of pearls cysts on their ovaries. I usually would get like 4 or 5 on my ovaries. You have to have like 18 to 20 or something like that. I feel like I don't even live in a real world sometimes. There's just so much information on the internet, and like there's different definitions everywhere I go. I close my eyes, I open it again, there's something else. I used to think I was misdiagnosed with PCOS, but because I had anovulatory periods, they used to have this thing called the Rotterdam criteria, and it was like four different types of criteria, or 4 different criteria. There were 4 different stages or types of PCOS that you could have, and I think I was like the last one where I didn't have hirsutism or like androgens, but I had anovulatory periods or like no period. And I had some cysts, but not the right amount of cysts. And I had insulin resistance for damn sure. But then my ovaries were heavy enough. So like you have to have a specific amount of, I think like 10 or more or 15 or more cysts on an ovary, or your ovary has to be a volume of over 10 centimeters cubed, or I think milliliters. I don't know. But my right ovary recently was 14.25 centimeters cubed. So she heavy. She is still PCOS. PMOS, actually. With PMOS, you may have small sacs of fluid growth along the outer edge of the ovary. These are called cysts. I'll put in a picture of what it looks like. They look like little black holes on your ovary. Inside the small fluid-filled cysts are immature eggs. These are called follicles. The follicles are unable to regularly release eggs. The exact cause of PMOS is not known, but genetic and lifestyle factors may play a part. Early diagnosis and treatment along with weight management may lower the risk of long-term health issues such as type 2 diabetes and heart disease. Let me know what you guys think in the comments. I have heard, again, there's so much people on the internet just like, you can just spout whatever really you want on the internet, but like I hear it's one of those diseases that is caused by obesity but also is reduced when you lose weight, but it also can cause obesity. So it's so confusing to me. Like I don't really know. I can't even give you a hypothesis. I guess I would say my hypothesis is that obesity does cause something like this, and a way to prevent and fix it is to lose weight. And it just happens to be unfair that it makes losing weight extremely difficult, but not impossible. Like it's definitely possible to lose weight, and there are people on the planet who have PMOS who are thin. I want you guys to know that I do acknowledge that I still am obese. This is not I have a mirror, okay? But I am trying. I live a lifestyle that not everybody can do. Not everybody wants to do this. Not everybody wants to give up bread or sugar or candy or pizza. I live changing a lifestyle change is hard. I'm not even gonna lie. Some people are like, it's so easy, just do it. And it's like, no, it is hard, especially if you've been living with carbohydrates like your entire life and you're like addicted to food, which is very common, especially if you are obese. I'm not gonna give up just because weight loss is a lot slower for me than it is for others. I also have Hashimoto's, which has to have its own episode. Today's episode is PMOS, but like having Hashimoto's and PCOS, I'm seeing a lot of people have this, and I don't know. Can we get to the bottom of like the cause of this? I have so many theories. I think we were pushed birth control way too young sometimes. I also think that like, yes, the food in our society and just like constantly eating and insulin resistance overall for our entire our lifelong battles with insulin resistance unknowingly. Early diagnosis and treatment along with weight management may lower the risk of long-term health issues such as type 2 diabetes and heart disease. So I am pretty sure I had pre-diabetes twice. So I'm almost certain that I had type 2 diabetes when we lived in Oregon and I found the ketogenic diet because I was getting migraines like crazy and they ended up being related to like high blood sugar. Then I got down to like a healthy weight, but I still was bigger than I am today. It was just it was just new, right? It was just new to me. But then after I was good, and then I started drinking again, and then I started eating like shit again, and eating fast food again, and eating carbs again, and then the Pandorama happened, and then I got fat again. So at two, I'll try to put a picture up, but like at two, I think I was 222 there, bouncing between 222 and maybe 226 or something like that, just fat, and then got pre-diabetic again, got put back on metformin, which metformin was only just to slow down the type 2 diabetes from coming, basically. But really what helped me reverse the pre-diabetes and then the insulin resistance was just complete diet change, avoiding the foods that make my insulin spike like crazy, And now it's kind of crazy, you guys. You're like, Robin, well, now when you eat sugar, you're probably gonna blah blah blah. It's gonna be this and this and this, and you haven't really healed insulin resistance. You just are avoiding the insulin spikes. No, I will send pictures. I will send pictures to my gals of me after I've had like a sugar thing, like a cookie or a slice of pie or whatever, and literally so fast my blood sugar will rise up and then drop like a normal person's. And the first time that it happened, I cried because I was like, this is, I feel normal, like I feel finally like I'm normal. So my not only have I reversed my insulin resistance, I can test it and show you that it's reversed. I can have carbohydrates and it like it rises like a normal person's would rise, and then like an hour and a half later it's back down to baseline. So it's possible, you guys. And if you are interested in learning what I eat in a day, which I am so afraid to show what I eat in a day because you guys would be like, Robin, that's gross. It's a ketogenic diet, and not everybody, I mean, it's just not pretty. I don't think that it's gross, but like some people, I mean, it is a lot of fat. But that's what I run on, right? Like you guys should see my tea has a lot of coconut cream in it. Symptoms of PMOS often start around the time of the first menstrual period. Sometimes symptoms develop later after you have periods for a while. So, you guys, I'm 35 years old and I have never had a regular period. I think there have been like maybe a time in my life where maybe like a year since my husband and I have been married where I had a regular period. They're a little bit more regular now, but I do have an IUD, and so my periods are light. But I did have a regular schmegular period this month. Do you care? Probably not. But yeah, I'm 35 years old, have never known when my period is coming. I can kind of get like I'll get weepy and I'll be like, maybe my period's coming, and then it comes. But it's never calendar or clockwork. Ever. When people are like, my period's coming next week, I'm like, how do you know? What do you mean, right? The symptoms of PCOS or PMOS vary and can change over time. Some women with PMOS may have severe symptoms while others have symptoms or no symptoms at all. A diagnosis of PMOS is made when you have at least 2 of these symptoms. Okay, so we're going to get into the symptoms. All right. So it used to be you had to have like, let me see, Rotterdam criteria. It used to be that you had to have, this was the criteria, the Rotterdam, the diagnostic criteria for PCOS. So category 1 or type A, androgen status, clinical hyperandrogenism or hirsutism, hyperandrogenism or hirsutism, biochemical hyperandrogenism. Category 2, menstrual history, frequent bleeding or intervals. I had frequent bleeding at intervals less than 21 days or infrequent bleeding at intervals of over 35 days, which, yes. Category 3, ovarian appearance, ovarian size, morphology found on ultrasound, presence of 12 or more follicles of 2 to 9 millimeters in diameter, or an increased ovarian volume of 10 milliliters or centimeters cubed. So, yes, I have a 14 milliliter ovary. All 1, 2, 3 categories must be present. Rotterdam criteria. Okay, so the NIH criteria, the old criteria, you had to have all of these to be diagnosed with PCOS. The Rotterdam criteria, you had to have 2. But yeah, so the Rotterdam criteria for the longest time, this was the go-to diagnostic criteria, and you had to have 2 out of 3 of these, and I had category 2 and 3. When to see a doctor. See your healthcare professional if you're worried about your periods, if you're having trouble getting pregnant, or if you have symptoms of too much androgen. This might include new hair growth on your face, body, acne, and male pattern hair loss. All right, so let's see. Risk factors. So we already talked about the causes. The risk factors. Certain risk factors may increase the risk of PMOS, such as having family members who have PMOS, being overweight. That should be number 1. If you're overweight, you gonna get it, girl. Or having obesity may put you at risk of PMOS. Insulin resistance and too much androgen activity may also contribute to the risk of PMOS. So insulin resistance can actually cause androgenism, like hyperandrogenism. And it's not like insulin is just pumping in like more testosterone. It causes an imbalance of your other hormones. So like, okay, so insulin drives up androgen male hormones. It stimulates the ovaries to increase testosterone production, lowers sex hormone binding globulin, a protein that locks up testosterone in the blood, and amplifies. Okay, so it just causes just a shitstorm. Just a fucking shitstorm. Complications: infertility, pregnancy complications, metabolic dysfunction, associated liver disease. Oh, previously, wow, why are they changing names? Oh, stop. Metabolic dysfunction associated steatotic liver disease, previously called non-alcoholic fatty liver disease. Can we just cut out the non-alcoholic fatty liver disease and just call it fatty liver disease? I think a lot of people will just assume that if it doesn't have non-alcoholic or alcoholic fatty liver disease attached to it, we're just going to be like, it's metabolic then. You've eaten yourself to a fat liver. This happens when fat buildups in your liver, which is a risk factor for cardiovascular disease, metabolic syndrome. Metabolic syndrome is a group. See, this is what I thought I had. I was like, I don't have PCOS. I think I've been misdiagnosed. I have Hashimoto's, and that's causing a lot of the diet and the fatness and all that jazz. And I thought I had metabolic syndrome. Metabolic syndrome is a group of health issues that often happen together. Metabolic syndrome can include high blood pressure, high fasting blood sugar. That's me. That was me. And unhealthy cholesterol or fats in your blood. These fats are called triglycerides. Having these can significantly increase your risk of heart disease and blood vessels. So did you know, a lot of people think that by lowering your fat intake, you will lower your triglycerides. But actually, fat in like triglycerides in the blood are actually more hand in hand with like excess glucose in the blood. So when I had pre-diabetes, my triglycerides were like through the roof. Then when I switched to eating mostly fat, no like almost zero carbohydrate, triglycerides, you'd think they'd be through the roof too? No, baby levels, beautiful levels. Your triglycerides build in the body because of a glucose thing. Okay, triglycerides and glucose are intimately linked. Excess blood sugar from carbohydrates is converted into triglycerides for storage. Chronically high levels of both often put into insulin-resistant metabolic syndrome or prediabetes and significantly increase cardiovascular risk. When you consume more carbohydrates or sugars than your body can immediately use or store as glycogen, the surplus is converted into triglycerides. Type 2 diabetes or prediabetes, sleep apnea. So this is when you stop breathing. Yeah, you get sleep apnea from PCOS because you get so fucking fat. Mental health issues, depression, anxiety, and eating disorders can happen with PCOS. Uterine and ovarian cancer. So you guys listen up. Mommy had precancerous cells for uterine cancer in my uterus a couple of years ago. I'm still getting biopsies every 6 months for them now. I am treating it with an IUD, and you're like, whoa, what? How is that treating it? Because the IUD sits in your uterus. It topically, because it's technically like sitting on top of like the entire like the skin, the tissue in your uterus. It's topically treating it with progesterone, which is what's preventing the lining from getting too thick and causing cancer. So, okay, so that is the brief rundown of PMOS and PCOS. We're going to get into some reels and some infographics on Instagram. We're going to talk a little trash about some of the people who use PCOS or PMOS as an excuse to remain fat and eat whatever the fuck they want. And we are going to judge. There are some people on my little list that I think are enablers of obesity and enablers of people who have PCOS, because listen, I refuse to enable people who are like, oh my god, it's so hard to lose weight, blah 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 blah, because and you know, maybe I'm an extraordinary person, I don't know, but I've lost weight with PCOS. I'm still on a weight loss journey. I'm still technically obese. I am bouncing between the same 5 pounds, but I'm not going to give up because it's hard. Diet change is hard, sure, but it's not impossible. And I refuse to be like,
You're right, it is hard. Why don't you just keep eating french fries every meal?
I don't know. I just refuse to be that person. So let's get into it. Okay, I'm going to do this little brief infographic. They did a great job explaining everything. PCOS is now PMOS. Here's what that means for you. So I don't think it changed much. A lot of the intelligent people who have PCOS know that it was a metabolic thing. I don't think much has changed. They're going to explain what has changed, but I mean, if you have had PCOS for a while, it's always been, to me, in my opinion, it's always been a metabolic disorder. It's never just been like a lady thing, right? The what I would say the nice thing about it being identified and seen globally as a metabolic disorder is now I don't have to go to a doctor. Like I don't have to go to a gynecologist to get treated for PCOS. I can get treated for PCOS by my general practitioner. And I actually, a few years ago, I have screenshots. Hold on a second. Okay, so I have screenshots of a couple of years where I told my doctor, because this is what it looks like to advocate for yourself. Okay, you guys, I told my doctor because I wanted to get back on metformin. This is 2022. This is about the time where I was like, "Whoa, bitch, you're 222 pounds again. It's time to like pump the brakes and lose some weight." But this is what it looks like to advocate for yourself. So if you guys are like, I need to be strong and I need to tell my doctor what's up because my doctor works for me. This is how you do it, okay? Hi, whatever your bitch's name. I know you requested that I go to my gynecologist to ask for metformin. Oh yeah, I was wanting to get metformin so I can prevent myself from getting diabetes because metformin does work to prevent it slows it down, but overall PCOS is best treated with diet and nutrition and lifestyle changes. Metformin just helps slow down your chances of getting type 2 diabetes. Like that's how I describe it. That's not the actual definition of what metformin does. Metformin does something, it doesn't like increase insulin. It just helps like your body like absorb sugar in a specific way. I don't know. It does something to help with insulin resistance. It doesn't reverse it or heal it or anything. It doesn't add more insulin to your system. It doesn't lower your blood sugar per se. It was a great tool to prevent me from getting fatter and getting type 2 diabetes. Like it slows down the progression of insulin resistance, in my opinion. I'm not a doctor, look it up, okay? I know you requested that I go to my gynecologist to ask for metformin, but I was wondering if you or Dr. Blank, my actual doctor who I had never seen, this is me talking to his nurse practitioner, would please reconsider and prescribe the medication. It took a long time to get my gyno appointment and they canceled me today. With weight loss this year, 15 pounds, which is extremely difficult with PCOS and dietary restrictions, I've cut out sugar completely and reduced my carbs since January of 2021. Yeah, dude, I was on a weight loss journey from January 2021. I wonder how much I weighed in 2022. I'll have to look it up and plug it in. But I feel like I was still fat as fuck. I feel like trying metformin is the next necessary step and would like to be prescribed it to you as you ordered my A1C and my sugar was in fact elevated. If you can't prescribe me metformin, I've rescheduled my appointment with a gynecologist because PCOS is not a gynecological disorder, but a metabolic one as well. I was hoping you or Dr. whatever could help me out and prescribe me the metformin. Happy Monday, Robin. And then this is what they replied. Good afternoon. I would not have any issue with restarting metformin daily for you. I would still prefer you follow with the gynecology as well. We can continue to monitor your glucose and A1C in approximately 3 months. As a prescription for metformin 500 daily for 3 months sent to the pharmacy on file, blah, 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 blah. So I advocated for myself. I got my metformin. It's, in my opinion, always been a metabolic thing. So the PCOS being called Pmos is only exciting for people who aren't really educated on that. Maybe somebody who's new to PCOS, maybe somebody who didn't do any research when they were diagnosed 10 years ago. You know, I could be judging, but let's continue. A new name, a bigger picture. After years of research and thousands of voices, PCOS is now officially PMOS, polyendocrine metabolic ovarian syndrome. This new name reflects the whole body impact of the condition, not just the ovaries. So it still has ovaries in it, which I'm like, it still has ovaries in it because your ovaries are still, a part of the disease. It's just the cystic part was, I think, throwing people off because they're technically not cysts, they're follicles. They're not really, I don't know, when you hear cyst, you think of something that needs to be removed, and they're just like something that just gets reabsorbed. I'm not sure. All right, not just ovaries, the whole you. PMOS includes more than just ovarian cysts. It can affect hormones, metabolic insulin, energy and mood, skin and hair, heart, and long-term health. Again, this is nothing new. PCOS, if you really, really looked into if you got diagnosed with something and you were just like, okay, I've got PCOS, and then just like went on with your day, I would really, really, let's not do that. I would really judge you. I judge people like that. People who don't want to get the bigger picture. People who just trust trust your doctor clearly, but like people who just trust blindly and just go, I'm just gonna, this is it, and don't do any like more research or find a community or anything surrounding their newly discovered disorders or whatever, don't you want to feel better? I don't know. It's always been a metabolic thing. I'm confused why. I'm confused. We're going to figure it out together, but I am confused why so many people were like so excited about this name change when I'm just like, it's always been metabolic to me. But, I like to learn. Okay, why the change? Many with PCOS don't have cysts. So I also do not have cysts. So I guess that makes sense. It was throwing people off. The old name caused confusion, misdiagnosis, and delayed care. It was overly focused on fertility and not overall health. This change is backed by global research. Okay, so did you guys know this actually? The name change was actually determined last year, I believe, or even in 2024, but it was like globally accepted in 2026. I can see, I wouldn't say that it was overly focused on fertility because I'm seeing a lot of people who are choosing to be child free in the 2020s. I would say that so yes, the removing the cystic part, perfect. Great, great, great. The old name causing misdiagnosis or delayed care. I think a lot of people are this is correct. A lot of people are not getting diagnosed with PMOS or PCOS because they do not have the cysts. Thankfully, my doctor, when I was diagnosed, probably just knew that not everybody with PCOS doesn't have cysts, but I also just had like 3 or 4. I always have like 3 or 4 cysts at a time, like follicles at a time, which I guess is, I don't know, is that normal? Let me know. But I did have the weight requirement or the volume requirement for PCOS. But I can see how frustrating that could be. I can see how someone being like, I don't know what the fuck is going on. Like, why am I so fat? And then not being able to find out that they have PCOS, which would then lead them down the line, or lead them down this rabbit hole of discovering that they have insulin resistance and then doing whatever they can to reverse that insulin resistance. That can be frustrating. That could be frustrating. And I know that like a diagnosis isn't going to fix everything, but isn't it so empowering sort of, or so like, don't you feel validated when you do get a diagnosis? Like, I know a lot of people who, like, when I got diagnosed with Hashimoto's, like, I felt I didn't even have, I always knew that I had hypothyroidism. Like, I was just like, I have hypothyroidism. But when they finally did the antibody test, they were like, no, you have Hashimoto's. You have to start doing XYZ. You need to start like focusing on rest and yada yada yada. I felt so seen because I really was like, am I this fat fucking lazy bitch that I can't even like stay awake? It really is validating. So like I can see how somebody being so frustrated with the way that their body looks, or how, getting a diagnosis can validate and explain so much. Like I can imagine somebody being so frustrated with, why can't I lose the weight? Getting diagnosed with PMOS, being like, oh, that's why I can't stop thinking about bread, is because I'm insulin resistant because of this PMOS, right? That's just an example. But I also, another thing too is like I've heard people who finally get diagnosed with ADHD or with autism, and they're just like, oh, that explains so much why I'm so quirky or whatever, right? It's validating, and it also, getting a diagnosis helps you find treatment, right? Clearly, you're not going to just randomly just assume that you have PCOS and then go treat it for no reason, right? It's getting a diagnosis helps you find treatment. Same new name, more understanding. This isn't just a name change. It's a step towards better care, validation, and support. So yeah, so like it is validating when you find out what's wrong with you and you're able to treat it like yourself. I don't know. It's nice. It is nice. Okay, what does the name change PMOS mean to you? This change is more than a new name. It is a new way of seeing the whole picture of PCOS. We want to hear from you. A new name, a bigger picture, a stronger community. So, speaking of community, there used to be this person. I don't know what her name was. It was something girl, and she blocked me a long time ago. But it was because I was telling people to go keto because that helped me with my weight loss journey. And she would stitch my TikToks and be like, no, you don't have to do this. You don't have to do this. Like, you don't have to do shit. But like, you also, it would help, do it, try it, give it a try. I don't know. She blocked me a long time ago because I she was like, you don't have to lose weight, but then she got on a GLP-1 and I'm just like, what's your goal? What are you doing? I don't know. It just felt very hypocritical, I guess. I don't know.
Here's a little bedtime story about how the world really works. You take a condition affecting 170 million women and you rename it from a reproductive disorder to a metabolic disorder. And overnight, you have created the clinical justification to put 170 million women on GLP.
So what I'm getting at, or what she's getting at, is that the whole reason why her hypothesis for the whole name change is that they could actually insure it so that people can get on weight loss medications. I don't know if that's necessarily the case. Um I think that it was necessary regardless for the change to be more for the name to be more like metabolic based. It makes sense that it's metabolic now than it is the name change was inevitable is what I'm trying to get at. And she's trying to say that it was purely to get people on medication. But let's see what else she has to say.
GLP-1 drugs. This is how stuff gets done in our modern medical environment. A couple weeks ago, polycystic ovary syndrome, known as PCOS, was officially renamed polyendocrine metabolic ovarian syndrome, PMOS. Every women's health influencer on the internet was popping her champagne and celebrating, and I am not going to tell them that they're wrong. I have long said for years that this is not an ovarian problem. The cysts are.
Yeah, a lot of people who have had PCOS for years and like are doing the things to treat it, like eating properly and all that jazz, we know that it's metabolic.
Even real cysts. The root cause is and always has been metabolic. You can treat this with a ketogenic diet. The new name is more accurate. It's important to understand this is metabolic because a metabolic approach can treat it. In fact, it can treat it better than any drugs ever on the market until these GLPs arrived. But here's what I need you to really understand. We knew it was metabolic and no one cared. Not enough to do anything about it until now.
Okay, so yeah, she is right. Nobody truly cared. Nobody cared to talk about diet change. Nobody told me to change my diet. I literally had to research it myself, find a community online, find the ketogenic diet and lose weight that way and get healthy that way. And now that there's a drug out there, they're like, let's change this name. I get it. Okay.
So I was curious. Why was that? So I decided to look into it. And lo and behold, the researchers who drove this renaming through the Lancet disclosed in their paper that they received grants and honoraria from Novo Nordisk and Eli Lilly, the companies that make Ozempic and Wegovy, Mounjaro, and Zepbound, all the GLPs. Medicine didn't suddenly start caring about women's health. This condition has been underfunded and misunderstood for decades. What changed is that there is now a market. A definition shapes a diagnosis shapes a treatment, and a treatment shapes a market. That is so important to understand because the people funding the science know exactly where the chain ends, and it almost never ends with them teaching you about lifestyle intervention. So two things.
I understand that funding is like important, but I do find it so strange when I'm not sure if I'm wording this correctly, but I do find it so strange that like so much research is granted and funded by Eli Lilly or the American Heart Association or all of these, medical masterminds, like these big corporate like I don't know what I'm trying to, if I'm wording this correctly, but it seems like they're kind of like pushed in the direction, like this is very tinfoil hat, but it seems like they're pushing the direction to like to the findings of these medical journals are pushed in the direction, or they benefit the medication companies. Does that make sense? I'm not sure if it's so early. It's like it's so understandable to see where people tend to not trust medical journals when they are being granted or funded by like big medicine companies like Eli Lilly and Novo Nordisk. But who else is going to fund it? I'm just saying is that we've seen it in the past. Like, if you guys didn't know this, I guess Harvard got like paid by Big Sugar to skew some results on heart disease and sugar and fat, and that's why everybody went on the low fat craze, because Harvard releases this journal saying that fat caused heart disease, when we all know now that it's extra sugar that caused heart disease, but the damage has already been done, you know? So the fact that Novo Nordisk and Eli Lilly funded this journal or these studies to show that PCOS is metabolic and would actually do really well with these GLP-1 medications, and now they're about to get another big bunch of, you know, another demographic of people who need their medication. It's very, very, it's very like evil. You know what I mean? It's very, very much like, ooh, I'm gonna be like, it's very robber baron. It's very evil, like money man. Like, I don't know.
Can be true at once. The name is right. It's much better to call it what it is. It's a metabolic disorder. And you need to know exactly why this change happened now and what they're leaving out of the story.
Woman just find out her condition was misnamed for decades. PCOS, now called Pmos. They changed it 2 days ago. 11 years, 22,000 women say name is wrong. They finally listen. Pmos stand for polyendocrine metabolic ovarian syndrome. Poly means many. Endocrine means hormones. Metabolic means how body process energy. Ovarian means ovaries involved. Syndrome means collection of symptoms.
I was like, why the fuck is she talking like that? It says PCOS is officially renamed PMOS this week. Let K woman explain. There never were actual cysts. The cysts were undeveloped follicles. Because that one word, women without visible cysts were sent home undiagnosed for years. That's very true. I'm very fortunate that my doctor knew that you didn't have to have cysts to be diagnosed, which is just like, the criteria is literally like one page. So your doctor could have just looked at one page and been like, oh, she doesn't have this or this, but she has this and this, so she has it. I don't know. PMOS stands for polyendocrine metabolic ovarian syndrome. It finally names what this actually is: a hormone and metabolic disorder that also affects the ovaries. 1 in 8 women have this. Most are undiagnosed. If you have irregular periods, acne, hair loss, fatigue, or unexplained weight gain, and you've been told your labs are normal, you know, most of the people that do have PCOS, I don't think I've ever known anybody that has PCOS that has had normal labs. Let me know if you have had normal labs. I don't see it. It's usually at least an elevated fasted blood glucose.
Old name, say polycystic. Polycystic means cysts. So doctor look for cysts. Woman not have cysts. Doctor say woman fine. Woman go home. Woman not fine. Woman have hormone problem, metabolism problem, skin problem, sleep problem, brain problem. Woman just not have cysts. So woman not get diagnosed. New name, say hormones first. Say metabolism first.
The crazy thing is that, like, I feel it's just like a few years too late. The whole the metabolic thing, because so many people were already on board with it being metabolic. I just don't see. I think this is probably why it took me so long to kind of just like make content about this, because it's always been metabolic to me. And I feel like a lot of people with PMOS have always known this.
So I got a letter in the mail from my insurance saying they are no longer going to be covering my GLP-1 as of July 1st. And I was already kind of in my head about my progress, because I've been here before. I've gotten down to this weight, and it was at this exact point almost 9 years ago now that I plateaued and then proceeded to gain back 90 of the 150 pounds that I lost.
Damn.
Over the span of like 3 or 4 years. And so I was already kind of freaking out, like, man, is this the limit? Is this where it stops for me? And then I get the letter. And though I have been prescribed my GLP-1 for weight loss, my primary reason taking it is because I wasn't treating my PCOS. And this is a great alternative to metformin for treating my insulin resistance. But you know what? I can't control that. I can't control the medicine. I can't control my disease exactly. You know what I can?
Yes, you can. You can control PCOS and insulin resistant with a diet change. It just depends on what they're eating.
Control. I can control my daily habits. I can control the stewardship of my body. I can control how much I eat, how much protein I get, how much fiber I get, how much exercise I get. I can control my attitude. And if nothing else changes, if I never lose another pound, I am a heck of a lot healthier right now than I was 90.
Period. I've been saying this too because I'm also like plateauing. Like it's very difficult. I'm making changes. I'm trying to add more what's the word? Intentional movement, like doing steps and stuff like that. And I am counting my calories, which is kind of putting me into like a mental thing. It's just I'm not gonna get into it, but I just prefer not to care too much about the calories just because it does. I spiral. You guys, I'm just being honest with you. I like this gal's attitude. You can change. So you can treat insulin resistance with diet. And I'm going to die on that hill. You can treat it with diet. I know you guys don't want, not everybody likes to hear this, but like we are over carbing and we're not moving enough. If you're not an athlete, you do not need 230 grams of carbohydrates a day. Okay. You can treat insulin resistance, Pmos, with a ketogenic diet. And that's all I'm going to say. Oh, but I was going to say that, yes, I am plateaued. I'm stuck. But if I didn't lose another pound, I am happy. You know, I don't think that I look terrible. I don't think that, I feel like a beautiful woman, and I feel healthier now than I did even 6 months ago, you guys, because I'm no longer insulin resistant. My body reacts to carbohydrates the way a normal person's body would react to carbohydrates. I still eat ketogenically and I feel great and I run on fat and I feel amazing for that. If I don't lose another pound, I would be okay with it. Do I want to lose more pounds? Of course. I want to be like at least overweight. I don't want to be obese anymore, but I don't feel terrible, right? My Hashimoto's does kick my ass from time to time, but I know my triggers now, and it just recovering from that is difficult, and I'm having a hard time sleeping. But I need to prioritize that. I'm getting into a schedule though, a filming schedule, I think, starting this week, that's going to help with my sleep during the week, so that should be fine.
147 pounds ago, and the energy and the reduction in pain and the capabilities that I have now, they're worth maintaining. And so I'm going to focus on what I can do and keep going forward. I'm planning on doing a series soon of lessons I've learned along the way in losing 147 pounds. And definitely one of the things that I'm going to talk about is stewardship over results. What matters most is the daily decisions, the way that I daily steward the body that I've been given, and focusing on that as opposed to focusing on some desired outcome has been a whole lot more sustainable when it comes to habits and lifestyle change. So if you find yourself discouraged because you're struggling to reach some goal that you have, be encouraged that hopefully today you've stewarded your body well. You've given it what it needs. You've treated it the way that it should be treated, and that's enough. So I got a letter.
I loved her. We love her. I hope nothing but the best for her.
PCOS is apparently being renamed PMOS, polyendocrine metabolic ovarian syndrome, and honestly, I got mixed feelings. Yeah.
Oh my God. Let's listen to this. Look at this. Okay. I'm going to judge. We'll let her finish before I actually judge, but it's very, very fat acceptance. Okay. PCOS being PMOS, blah, 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 blah. PCOS is being renamed PMOS, polyendocrine metabolic ovarian syndrome. And yes, the new name may be more medically accurate. PCOS has never just been about ovarian cysts, but it's a complex endocrine condition that can affect hormones, ovulation, skin, hair growth, insulin regulation, fertility, mood, and more. But there's the part we cannot ignore. Putting metabolic in the name does not mean this should become another way to pathologize fat bodies. People with PMOS already face enormous weight bias in medical settings. Many are dismissed, blamed, undertreated, or told to lose weight instead of receiving comprehensive care. Listen, that is comprehensive care. Losing weight, like your lifestyle changes, can really, really help PMOS symptoms immensely. Like, even to the point where I've known people with PMOS lose 30 pounds and they get pregnant. And if you're like, it's not about, having a baby, blah, 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 blah. I'm a very, very stern believer, firm, I will die on this hill, that your fertility is a symbol of your health. Like, fertility is like the top tier health symbol, because we're animals, and like our number one, like the species is designed to pass on and to just keep going, right? So like fertility is health, in my opinion. I'm not trying to offend anybody. I'm not fertile, right? But I'm saying like fertility is like it's a top tier determinant of health, in my opinion. That's my opinion. I'm allowed to have it. People with PMOS already face enormous weight. Okay, this is not evidence-based care. This is stigma. Shut up. Dude, fat. I don't know. The 2023 International PCOS Guideline specifically names weight stigma as harmful and recommends weight-inclusive care, including asking permission before discussing weight and providing care regardless of body size. No, literally, treating PCOS can involve and should involve weight management. It should.
Let's talk about this. I'm Lauren. I'm a licensed psychotherapist and trauma
I'm not even.
specialist. I work almost entirely with chronically ill folks, disabled folks, bodies who have been labeled as wrong or dysfunctional one way or another. So this, though I am not a doctor and none of this is medical advice, and you should not ever take medical advice from any video on the internet. These are just my initial thoughts after doing literally so much research.
Okay, 2 pages.
On what the fuck is happening right now.
What the fuck?
So, okay. On the one hand, the name PCOS was always
On what the fuck is happening right now. Like, it's some kind of fucking dire situation.
What the fuck is about to happen? What the fuck?
Baby, it's a name change for something that we've already known was metabolic.
misleading. That is my opinion. The cysts are not really the core issue, or maybe I should really say for some people they may be, and for other people they may not really have cysts at all. So there is a part of me that's like relieved, because like a lot of people don't even have the ovarian cysts and have reported feeling really lost in the diagnosis, or they don't even get a diagnosis at all. And also then don't get suitable treatment. So the condition's not just about ovaries, and it's not just about cysts. It involves hormones, it involves insulin, it involves insulin dynamics, I really should say. It involves inflammation, menstrual cycles, fertility, skin, hair growth, mood, energy, long-term metabolic health. Like, it impacts all these things. So from a scientific standpoint, a broader name actually really makes sense. Like, I'm actually quite down for that. But where my therapist brain and my fat phobia alarm system,
Oh, brother, this guy stinks!
and my just like, ooh, stinky, stinky tech money, trying to make money system goes off and turns on, it's because once we put the word like metabolic up in there front and center, we got to be really careful. Because like when you hear the word metabolic, when you hear the word metabolism, you're thinking about weight. You're thinking.
Yes. Because it's been known for years that PMOS, treating PCOS, a great way to treat PCOS is weight loss, or just treating it metabolically. So changing your diet. Even if you can't lose weight, I'm still obese, but my symptoms are like, I don't have PMOS symptoms anymore. Where are they? Right? I mean, I still have a fat ovary, but like, what do you mean?
About weight, specifically being fat, being in a weight that is deemed unacceptable, unhealthy, gonna kill you, like,
yes, being obese will kill you.
all of this. You think about weight. So when we have metabolic front and center, we just kind of have to be very, very careful. And in the
crazy thing is she's throwing this fit about the metabolic part, and like it's about weight, when the other gal was mentioning that the whole reason why they did this was so that people can get GLP-1 medications, which, yes, it's going to make Eli Lilly and Novo Nordisk a shit ton of money, but they're going, people who have not been able to lose weight with PCOS for years are going to finally have access to the magic bullet that's going to make them lose the weight, right? Which I'm a natty girl, right? I'm okay if you use it. I again, 2026, whatever it takes, lose the weight. But I mean, what people are going to be able to treat this with weight loss in a way that they've never been able to treat it ever in their lives. I think let them do it. Let them have the GLP-1
version of this shift, or in an ideal world, and spoiler, we don't live there, metabolic means like, let's stop reducing this to fertility and cysts and actually take people's whole body symptoms seriously. But because we live here, it really becomes flattening it into, this is a weight problem, lose weight, here's a GLP-1.
It's not a weight problem. It causes a weight problem, but losing weight helps with the symptoms. And you're going to get this GLP-1 and watch. These gals are going to get on GLP-1 and we're going to have a baby boom. We're going to have a baby boom, you guys. People are going to get pregnant. People are going to get pregnant.
Bye. And that's not better care.
You don't know. Literally, losing weight has helped women with PCOS get pregnant. Like, literally losing weight. Just, again, I've known people who just lose 30 pounds and get pregnant. And they're still fat as fuck. Sorry, guys. But they really are. I would prefer to see people get education on doing lifestyle changes and, like, actually, like, you know, again, I would... because I've had PCOS so long, I will sell you ketogenic. If you've got PCOS and you're like, I'm fat still, can't do anything, still have problems, I'm type 2 diabetic, get ketogenic. Get ketogenic. Like, just get ketogenic, right? Losing weight will help because excess body fat on your body is hormonally active and is a metabolic syndrome. It's a metabolic disease. PCOS is a hormonally active disease. So if you lose some of the body fat, you're going to ease the hormonal shitstorm that's going on in your body. And if the only way that you can lose the weight is taking a GLP-1, so be it, right? Some people just don't have, I guess, some people just can't do metabolic, like some people just can't do lifestyle changes. GLP-1 could be a tool in their lifestyle change. Why wouldn't you want them to get better? I mean, if a GLP-1, so I know that GLP-1 isn't like GLP-1 treats PCOS. GLP-1 treats obesity, right? And insulin resistance, whatever. If the GLP-1 causes the body fat to disappear from the body and that person's PCOS symptoms are relieved, what's the problem? No, I don't see a problem with that. I really don't.
That's not good care. That's just like old medical fat.
See, this is just telling me that this person doesn't believe that excess body fat on the body causes like issues. Like, if you have excess adipose tissue on your body, you run the risk of type 2 diabetes. It acts as another organ, you guys, and that organ is very, very hormonally active, and you run the risk of getting different types of cancer. You run the risk of all of the diseases. I'm just joking, but like type 2 diabetes, heart disease, cardiovascular disease, sleep apnea. I don't know. There's a whole list of things that you can get from being fat as fuck. And this gal just sounds like she doesn't believe that fat is bad, which is stupid. But having a lot of extra fat on your body is never going to be healthy. It's always going to be bad. And if losing weight, if losing body fat helps PCOS and taking the GLP-1 helps PCOS, do it.
Phobia with like updated branding and like tech money dumped into it, honestly. So if weight is connected in terms of symptom, it's a symptom connected to the root issue. What I'm trying to say clearly is weight is not the cause. It's not the diagnosis. And it's also not, it's not a meaningful treatment target. So
see, she's stupid. That's all I'm going to say. She's stupid. So, okay, wait. There's people who think that it is the cause, or it is caused by PCOS, or it is the cause. Like, there's people who go back and forth. But again, excess body fat makes things worse for PCOS. So if losing the excess body fat can ease the symptoms, it's good in my book. She doesn't believe that because she's stupid.
With the explosion, and I'm saying explosion because it feels like a fucking explosion of GLP-1 medications, telehealth startups, the weight loss tech, you know, his and hers, and metabolic health marketing. I mean, even like fucking Noom. I remember when Noom, God, yeah. Noom. Oh, I could go off on that. It's just all the same shit, just packaged differently. But we should absolutely be asking who benefits when a complex endocrine condition gets rebranded in a way that can be easily folded into a weight loss pipeline, excuse me. So what I'm saying is like, okay, let's say all the science behind this is solid, legit, so there. Okay, you still as an informed individual need to ask yourself, context, why is this happening now?
Okay, regardless, we all know Novo Nordisk and Eli Lilly are trying to make money. However, there are so many people with PCOS who need to lose weight, again, because it's hormonally active and causing more issues and causing more problems with this person who has PMOS. People can be like, oh, that's kind of shitty, but cool. Now I have access to this medication that my insurance would have never covered. I just don't see, can we all play the game? Like, are we not allowed to play the game because somebody, I don't know. Maybe it's not a nice thing to play the game because you know that Eli Lilly is going to make a shit ton of money, but guess what, you guys? They're going to make money anyway. They really are. And you are a pawn in this planet. And if you want to live a long time, you need to lose weight. So like, do what it takes.
Women have struggled with PCOS, all different kinds of gynecological health symptoms many of which still are not researched. So why is this happening now? Why is there suddenly a spotlight on this?
Yes, we understand. It's because they want to make money, but let people lose the weight if they need to for PCOS. I'm just so confused why do you not support women?
Why is this suddenly having credibility? Why is the weight thing being really seen from this compassionate lens versus like here's kind of it's your problem and your fault? Like, why are we now seeing it as a feature of this, if not to then be able to boost the prescriptions and the money coming in? So, like, on that point of context, GLP-1s are a massive market. McKinsey reported prescriptions grew 38% annually. 38% annually between 2022 and 2024 alone. And sales were expected to reach $100 billion by 2030 for GLP-1s. So again, we have to think about...
Okay, they want to make money. All right, perfect. But now people with PMOS can lose weight and treat their symptoms easier. I don't know why this is a problem. Do you guys think it's a problem? I mean, I know it's a problem, right? We don't want corporations to whatever, they're making more money and we're just getting poorer and poorer and poorer. However, we can only garden the garden that we can reach, right? We can only water the garden that we can reach. And I'm all for people with PCOS getting on weight loss medication to help with their symptoms. I really am. Whatever it takes in 2026, you guys. Everybody's so fucking fat, and PMOS feels better when you are not so fucking fat. It really is.
Why is this happening now? What would the potential benefit be in this country?
The potential benefit is that people with PMOS who are morbidly obese will not be so morbidly obese and will live longer, but also then their symptoms will get better. Like, it's proven that when you are in a smaller body with PMOS, you do not feel as bad than when you are morbidly obese with PMOS. It's proven. I proved it.
Country, health is a business. Your body is a product. So why
get better? Why would you want to get better? Because you getting better is going to make this company richer. So don't even, just die. Okay.
Why? I'm harping on this because it's fucking important. So my take is this. GLP-1s are not bad. They're not bad. It's a medication that's been absolutely fucking incredible for people. And the people who prescribe...
It's she's doing that whole thing. You have the bodily autonomy to lose weight. But...
And the reasons why people prescribe them, they can be kind of bad. That could be bad, and that could be really damaging and harmful. And I believe that everyone should know what the hell they're doing What is going into things on the back end? If the science is there, cool, great, awesome. But I don't stop there. I want to know, why is the science there now?
She's harping so much on like, you guys have to know why. Okay, you literally, this has been going on for, I'm not sure, like what, 5 minutes? You've literally been like harping and harping and harping on like, you guys have to know that they're just trying to make money. You could have just said, hey, everybody who has PMOS, they changed this name, but you know, they might just be doing that just so that they can make some money. Just letting you know that, and then we can scroll on. But you keep going, and I'm not gonna watch the entire thing. Okay, PMOS belly fat isn't simply a calorie problem, it is a hormone problem. I agree. Yes, nutrition matters. Yes, movement matters. But if you're only focusing on eating less and exercising more, you may be missing the root cause. Support your hormones, balance your blood sugar, manage stress, and work with your body instead of fighting against it. This is where real progress begins. So yes, I agree. I think that telling a person with PMOS who doesn't know that they have PMOS, I guess, I don't know. Telling a person with PMOS that it literally is just calories in, calories out is very difficult, and it's hard for me, and it was potentially harmful for me at one point. PMOS causes your, I would say PMOS lowers your TDEE. I'm not 100% sure on that. I don't know if that's the right terminology, but PMOS causes insulin resistance, and I feel like that can lower your TDEE, but it's not about like, yeah, sure, it's calories in, calories out, but what type of calories and what kind of food, where you source your calories can affect your PCOS. So if you have PCOS and you eat in a calorie deficit, but all you're eating is carbohydrates, you're going to have a slow time losing weight because your body's going to be producing so much insulin to help move this glucose around that your cells are resisting, right? Whereas if you switch to a ketogenic diet or a low carb diet and you're eating less carbohydrates and you're still eating in a calorie deficit, that makes sense because your body will actually use the fuel instead of just storing it. But let's see what she has to say. Okay, so I'm gonna cut the music out. It says, screaming because I just saw a doctor post about how PMOS belly means you should eat less and move more, but PMOS belly is not a fat. It's not fat the way we think. A PMOS belly is fat sitting deep in your abdomen because of high testosterone, insulin, and cortisol. That's why cutting calories alone won't work. So please, sister, don't treat the hormone problem like a calorie problem. So yes, agree. Don't treat like, and maybe you guys disagree. Maybe you're like, well, I have PCOS and I cut my calories and I, was able to lose the weight. I don't think it's just that simple. And this is why I'm not like 100% sold on calories in, calories out. I'm definitely like, treat the hormonal issue with your, like, treat weight gain hormonally. That I don't know how to explain it. I think a lot of people in this country are insulin resistant because we've been eating fucking fruit by the foot and gushers and cereal and bread since we were like little kids, and we still eat like children sometimes. There's people who still are 30 years old and they're eating chicken nuggets for dinner. Like, I'm just like, you guys, a vegetable. Treat it hormonally. Don't just treat, like, there's so much. If you need resources, if you're like, okay, I'm not really sold on calories as well, calories still exist, right? I'm not denying that calories are, it's just a way to measure your intake, in my opinion, but not every calorie is equal, in my opinion. Like, calories from fat don't do the same thing as calories from carbohydrates. One of them's going to burn slower than the other. If you want a good resource, I would recommend that you look up Dr. Jason Fung. I'll put a video below that I recommend to a lot of people who are trying to lose weight, but not in the simplistic eat less, move more, calories in, calories out situation. He's very much an insulin, like control insulin, control your body fat kind of guy, which is beneficial to me. This says, why are you morbidly obese? Living with hormonal imbalance like PCOS means navigating invisible battles, but a stranger's size is never an invitation for a health audit. Your body is your business, period. You don't owe anyone a medical history or explanation, just to exist and be respected.
While this person is obviously coming at this in a very rude way, I would like to take a moment to talk about this. I have PCOS, which the name has recently been changed to Pmos, but it's a complex hormonal condition that affects the metabolism and insulin resistance. Honestly, my health is really great, but even if it wasn't, it is nobody's business. Comments like this don't really bother me anymore, and I would like to use my platform to say that if someone leaves a comment like this for you, you don't owe anyone an explanation just to exist.
I wouldn't even have acknowledged that, but okay.
Fuck beliefs.
Okay, ladies, I'm sorry, but I'm sick of this excuse. Yes, having PCOS makes it more difficult to lose weight. Speaking from experience, this hormone imbalance promotes fat storage and increases hunger. Yes, period. It takes a little more discipline to lose weight with PCOS, but if you want it bad enough, you'll find a way to have that discipline. I'm so tired of hearing people say it's impossible to lose weight with PCOS. I'm sorry, but you don't defy the laws of thermodynamics, period. Right? It is possible to lose weight with PCOS. You have to control your insulin. You have to control your insulin.
And avoid being
Let's
a
see.
zombie sheep. Ciao.
Okay. Shit. Look at her jaw. Look at her shoulders. Oh my Lanta. Damn, bitch. I gotta see. So she started working out and stuff, but what did she do? She's down 200 pounds. She wants to be jacked. God, her face. She is so thin.
You look like you're slimming down a little bit. Well, whatever you're doing, you should keep it up. Aren't you trying to lose weight? You shouldn't be eating that if you're trying to lose weight. No, you don't need to do all that. You just need to cut your carbs, cut your sugar, cut your sodium, cut your protein, cut your fiber. Just don't eat anything. Don't eat anything. 0 calories. 0 calories. Yeah, we were going out this weekend, but we didn't invite you. Because we figured you'd, be going to the gym and meal prepping and all that. So we didn't invite you. Oh, wow, you've lost
I love her hair. God.
a good little bit of weight. Yeah, I didn't want to say anything, but you used to be, really fat. You were disgustingly fat. You look great now, though. You actually, you really don't need to lose any more weight. You're actually a little too skinny now. You kind of look like a Holocaust survivor. You should really stop losing weight. Yeah, we get it. We get it. You lost weight, okay? You can talk about something else now. We get it. Have you lost weight? You look like...
That's funny. I want to know what she eats. Or if she's on a GLP-1. What I keep in the fridge.
I've lost over 200 pounds, and these are some things that I like to keep in my fridge to keep me from binge eating. Good, lean protein sources. I have 93.7 ground beef, 93.7 ground turkey. The more protein you have, the longer you feel full. Fresh fruits for when I want something sweet. This is always better than candy, because I used to eat the hell out of candy.
Okay, so she just stopped binging. Good for her.
If you want low-calorie fruits, the best ones to go for are berries. Cottage cheese.
Dude, I hate having Hashimoto's and having to quit dairy. I miss, you know how fucking hard it is to be ketogenic and not be able to have dairy? It feels like a crime. It feels like a crime. Not only am I Asian and can't have fucking rice, I'm ketogenic and I can't have dairy. It's not fair. It's not fair. Who the fuck eats like this? Okay, this says, I'm gonna cut the music out. What happens when someone with PCOS cuts sugar? Amazing results. Okay. Oh. Fat and addicted to sugar. Okay, so this is a gal who has PCOS but has hirsutism, so they have a giant beard. It says, why did you grow a beard? And then it says PCOS, polycystic ovarian syndrome. PCOS is a hormone imbalance that causes many symptoms, such as weight gain, hard to lose weight, irregular cycles or missed periods, hirsutism, excess hair in unwanted places, infertility, depression, anxiety, fatigue, etc. That's why I am a woman I'm a woman, I grow a beard. Why don't you shave? I did 8 years straight, laser twice, even wax, but she's here to stay. So you can prevent your beard from growing with PCOS with PMOS if you get your hormones like regulated. So again, it's a hormonal thing. I believe once you get the insulin resistance under control, it does regulate your your androgens and your male hormones. So something is telling me that this person has not done this. But while that replays, I'm going to read her thing. The shaving is tiring. The waxing is tiring. The nausea is tiring. The weight gain is tiring. The irregular cycles are tiring. The hair loss is tiring. Infertility is tiring. Anxiety is exhausting. Depression is exhausting. Mood swings are exhausting. I'm sorry that they're unhappy with their infertility. Screaming because I just saw a doctor post about PCOS belly is not fat the way we think. A PCOS belly is inflammation, water retention, visceral fat sitting on top, insulin resistance, and high cortisol. That's why cutting calories alone doesn't work. So please, sister, don't treat the hormone problem. Did we already watch this? Is it the same person? No, it's somebody else. Don't treat your hormone problem like a diet problem. Regulate your nervous system and get the 23andMe DNA test. You deserve to thrive. Jesus. What's the 23andMe test going to do? Tell you that you are a napper? Okay, this person has a beard. All right, part 1, why I choose to grow out my PCOS beard.
Your PMOS beard might not be right for you, but it was definitely...
Okay, I will say that they do pull it off. I mean, I guess if you have it and if shaving didn't exist, if you could pull it off, I guess good. I think that they pull it off, but they're wearing really great accessories and shit.
Definitely right for me. Here are some of the reasons why. To be an example for other girls, women, and humans with PMOS so that they know that they can live confidently, authentically, and out in the open. To honor my mental health, because it really hurt me to strive to try to meet beauty standards that I just could never meet no matter what I did. And honestly, I never agreed to those in the first place anyways. Did you? To bring awareness to PMOS, which used to be called PCOS. Because I can. For my kids, so that they love themselves no matter what they look like on the outside. And so that they don't judge anyone else for how they look on the outside. Because I like it. To shift cultural body standards for girls and women because the current ones hurt our self-esteem. Because the sensory feeling of prickles versus the sensory feeling of fluffy, soft things, okay? I like fluffy things. Because I have a really great opportunity to use it for good, so why would I choose not to? Because I want to. Because I can. Because I'm whimsical.
I'm scared. Let's look at her page. Maybe I'm being too nice. I think that they're pretty even with a beard, but I do understand, like, because I've had PCOS and I've been in PCOS communities online and stuff like that. It's hard, especially when you're unhappy. So I do appreciate that it's hard to have a beard or body hair where you don't want it to be. So I appreciate that this person has accepted themselves. We can't really truly hate on somebody who's accepting themselves, but I do think that they have, I guess for somebody who has a beard, they have pretty privilege. Are you guys also seeing that? Are you also seeing that? They also don't have like a ton. I mean, there is maybe a little bit of like body fat. Yeah, there's body fat. PCOS hit her hard, but I'm not going to keep watching her. They finally renamed PCOS to Pmos to acknowledge the metabolic effects of the syndrome. And no, it doesn't undo 20 years of being told just lose weight and go on the pill. I think she just spilled her salad. I think it's going to make people I'm not sure if this is doing what she means it to do. But I think that the name change to PMOS is actually going to make it so that people are like, no, you do need to lose weight to treat it. Treating it with weight loss is going to help you because it is a metabolic thing. I wonder if a lot of people are going to see this as like a backfire. Well, that one gal did say like when you put metabolic on it, people are going to see it as like a weight thing. And I don't think that's necessarily bad. Clearly, this is an anti-fat acceptance YouTube channel, but because it is metabolic now, or it's always been metabolic, but because people are going to see it as metabolic, more people are going to have a chance to get treatment for it, and weight loss is going to be a big part of that treatment. Yeah. Okay, sorry for the tears on a Monday, but PCOS is not for the faint-hearted. Waited over a year for this appointment, a whole year of hoping, struggling, and trying to be taken seriously, just to be told the only option is to lose weight. PCOS is not that simple. Hormonal, metabolic. Oh, sorry. Can you read that? No, you can't. It affects energy, mood, fertility, skin, and so much more. It's not something that can be reduced to a number on a scale. Okay, I agree. There's no like particular weight number, perfect weight for PCOS. But I'm not going to say that treating it with weight loss is a bad treatment. Treating it with weight loss works. Losing weight helps with symptom control. Being dismissed like that after such a long wait is exhausting and honestly disheartening. People with PCOS deserve to be listened to, supported, and treated as individuals, not given the same generic advice and sent on their way. Weight can be a factor for some, but it's not the only factor, and for many of us, it's part of the condition itself, not the cause. Telling someone to lose weight ignores the reality of what we're dealing with. Women's health deserves better than this. We deserve professionals who understand the complexity, who look deeper, who actually want to help, and not just tick a box. After waiting this long, I expected care, not dismissal. I'm wondering what this person did expect, because like other than just like treating PCOS with lifestyle change and weight loss, it's metformin. That's all I've known as treatment, unless you wanted to get like your stuff removed. So let's see what they are talking about.
Waiting a whole year for an appointment with an issue that had already been going on for a year, so we're now 2 years down the line, for them to tell you once again, like it's a non-stop record, that your only solution is exercise and lose weight. But what they don't realise, or what they do say, is that that's really hard to do in your condition. My PCOS girlies, someone please tell me it gets better than this. Like, it's triggering. It's so triggering. I'm like, so are you going to run bloods in case there's something deeper going on? Am I going to have an internal scan? Like, I'm a fit person. I love dancing. I love exercising. Like,
you may be fit, you may love dance and exercise, but what are you eating? That's the problem, you guys. It's like, they're like, I do all this stuff. I exercise. I do all this. And then they go home, you go and look at, and they eat biscuits and gravy every day or something like that. Like, that's a lot of the times it's fast food. It's carbs. It is carbs. I know I have this war on carbs, but we're talking about PCOS. This is like my dojo. Okay. If you have PCOS, no more carbs for you. Reduce them, cut them in half, you guys, okay? But it's insulin resistance. And losing weight will help with insulin resistance, but even if you couldn't just lose weight overnight, fix your diet and the weight loss will happen. The weight loss will happen. If you have PCOS and you reduced your diet or you started a ketogenic diet, you will lose weight. But you have to be honest with yourself too. And you have to track your food. And you have to track your intake, and you have to track your carbohydrates. Everybody in the comment section is just enabling her. They're just like, yes, it's so hard. It's so frustrating. This one says, yes, losing weight and optimizing body fat levels is super helpful for reducing PCOS symptoms, but it can be so hard to do that in the first place unless things are looked at holistically. Insulin resistance, poor metabolic health, and chronic inflammation, stress, gut dysbiosis, and thyroid function, toxicity, and mineral imbalances are some of the biggest drivers I see. I was diagnosed at age 17, told to struggle to conceive without fertility drugs. I'm now 31, 7 months pregnant after having healthy fertile cycles and being symptom-free for years now. Healing is possible. Yet they did not tell us what they did. A lot of people bring up, like, are we going to do any of these scans? Are we going to do any blood work? I mean, yes, if you really do feel like something else is wrong, but if you know it's PCOS, find a community online, figure out, go to Reddit. Reddit was a great source to see, because PCOS hits people in different ways. Clearly, we see, like, this gal is just overweight. I was just overweight. Another gal had a beard, right? It hits us in so many different ways. So if you find a community online, you guys can like chit and chat and talk a little, about what worked best for you. I'm going to tell you as a friend that ketogenic worked great for me. Look at me.
Look at me.
But yeah, run bloods for what? You have PCOS, treat it, right?
like I'm very grateful for the NHS, but I've waited a year for a problem that I've had for a year. Like, does that not ring alarm bells? I was trying to say, but what happens if this happens again for another year? Like, what are the solutions to just that? And it was, you can take a pill every 3 months if you don't have a cycle, and we'll go with that. I've waited a year for this appointment. Something's not right with me, and I know it's not, and I'm asking for you to just...
I wonder, it sounds like something's up with her period. She's not having a period. I know it sucks, but again, I'm going to bring up the gals who they literally lost 30 pounds, got their periods back. Sorry, Duncan. And got pregnant. I'm not sure if this is what she's looking for. I'm not sure if she's looking for fertility advice or anything like that from her doctor or whatever. Now, if she's bleeding a ton and her doctor this happened to me. I was bleeding a ton. I had a doctor tell me that I just needed to do some exercise. Get another doctor, but I know it's difficult with NHS, right? Thank God they have socialized healthcare, but at the same time, they don't get to choose who they go see, right? They don't get to get a second opinion. A lot of them don't. I'm not sure. I don't live there, but if you live in the UK, what do you do if you want a second opinion? Do you get that option? I mean, not know.
Investigate a bit further, but I don't know. I just think in a world of jib jabs, it's just so heavy. Sorry, I'm just processing with you all. Oh my lord, there.
Okay. Okay, I'm so sorry. I put this in here. It's so weird. I actually hate, I don't know why. And maybe I'm not as feminist as I think I am, as far as like being like everybody's equal. But I hate when men talk about PCOS because I'm like, you don't even know, bitch. Just like I'm sure a woman talking about testicular cancer. I don't know. Let's listen. Okay, a woman with PMOS can be overweight, exhausted, hairy, and yet she's being healthier than everyone around her. No, again, let me see what they're eating, because I'm guaranteeing you this lady is either hiding meals, extra meals. She may be eating like salad in front of everybody else, but I guarantee you, because I was one of them, I was eating a loaf of bread by myself.
Correct me if I'm wrong, but the paradigm with PCOS is, hey, you have this stuff going on because you're overweight, so it's your fault. Is that right?
There's this old way of looking at body composition with calories in equal calories out equals what your weight is. And that's not true. Women with PCOS have metabolic dysfunction that changes the way they use calories. Calories in and exercise don't equal your body size.
Mm-hmm.
The message I was trying to convey is that's not your fault. Healthcare was making mistakes, either because we didn't have these tools or someone hasn't read and kept up. So it's not a moral failing of the patient. It's a medical failing of the provider. Women with PCOS could do a water fast, 3 days of water, and gain weight.
Wow.
So it is.
If that happened, it's because they probably had like stored glycogen or I don't know if that's the right word. Their liver is producing glucose, and then the glucose is their insulin resistance, so their body's not responding to the glucose that their liver is producing. So that could technically possibly happen, but it's very, very unlikely. Again, with the calories in, calories out thing, PCOS, it's an insulin, it's a metabolic, it's a hormonal thing. I'm not going to be sold ever on just treating PCOS with calories in, calories out and moving around more, because it's just easier just to treat it with a ketogenic diet. Like, I don't know.
Clearly not calories in versus calories out. PCOS was never your fault. You had a genetic predisposition for this or something happened along the way. I want women carrying guilt weight to let that go because you didn't do anything.
Awful pandering crap.
Okay. Telling a PMOS woman to just lose weight is mentally exhausting because you don't understand that PMOS cause weight gain. Period. But it is possible. There needs to be more education on really what works and less pushback on what works, because like like there's a huge part of the PMOS community, the PCOS community, that is like, you don't have to cut out carbs, you don't have to cut anything, all you have to do is follow this plan and pay me this XYZ, yada yada yada. There's a huge part of the community that is against cutting down on carbohydrates, or believing in insulin resistance, I guess. I don't know. I wish there was more education and more like nutrition advice. Like, it would be really great for somebody who had a PMOS diagnosis to be prescribed a nutritionist versus just a GLP-1. So, okay, this says, oh, I just have a round face. And then she loses a shit ton of face. Nah, girl, that's untreated PCOS. That's insulin resistance and that's hormonal imbalance. But this girl lost weight doing something else. It says on here, failed VSG, and now she's on a GLP-1. That's what sucks about PCOS, you guys, is it just makes it so that you are like addicted to food. Like the fact that she failed, her VSG failed. I don't know if she failed it or if something happened. Maybe it broke, or I don't know. My guess is that she just ate it, which is I've seen happen. That's wild. But yeah, PCOS, it's like a little monster that lives with you forever. It really does make you like a hungry little monster, especially when you have insulin resistance. It's like it makes you so hungry, and you feel like you're doing everything you can, but then you just like mindlessly gravitate towards carbohydrates and food, and it sucks. But yeah, that it causes you to gain weight, but not in like a magical fat forming way, in a way that makes it so that you're just hungrier, basically. Just like when people say that depression medication causes weight gain, and it's like, no, the depression medication does not cause fat gain. If that was the case, they'd be prescribing Lexapro to like starving people in third world countries. Depression medication causes weight gain because it makes you more hungry, just like PCOS causes weight gain because it makes you more hungry and you're insulin resistant. So you're just constantly eating carbs because your insulin resistance is asking for more energy. So you're eating carbs for quick energy, but you're also insulin resistant. So you're storing all those fat, like all the carbs as fat. And it's not fair. It's not fair. That's all it is.
So just a little trigger warning before we get started: weight loss. I've actually lost almost 100
Trigger warning, weight loss.
pounds in the last 15 months. But most of my life I've heard from doctors, just diet and exercise, diet and exercise. You'll lose weight, just diet and exercise. So for a lot of my life, I've worked with nutritionists and personal trainers. I've stuck to a very strict diet and I still wasn't losing the weight. So imagine going to the doctor and trying all of these things and it never works, and then you think you're the problem because you stick to diet and exercise and nothing happens. Then you might understand that it's something deeper than just diet and exercise. So in recent years, I've been working with a naturopath who has put me on different medications and supplements, and I've actually lost 95 pounds. So a lot of times it's a deeper issue than
But is she gonna share what she's doing? Probably not.
Just diet and exercise. And comments like this is exactly why I haven't brought it up until now. I hope you have the day you deserve. So just a little.
Don't you hate that? She didn't tell us what she does. She's not a girl's girl. Why wouldn't you tell us what you do? I'm a little pissed off by that, actually. I'm a little offended. All right, you guys. So that is my coverage of the PCOS, PMOS name change. And we got to chit and chat about people and their opinions on the name change. We also chit and chat about people who make up excuses regarding the weight loss or regarding the treatment of PMOS and PCOS. What do you guys think about the PMOS name change? I don't think that it was necessarily. Do I think it was necessary? Sure. But I think most of the people who get a diagnosis and do research on their diagnoses know to, like, we all knew that it was metabolic to begin with. Sure, are they doing this metabolic name change so that like companies like Eli Lilly and Novo Nordisk can make a little bit of chump change? Sure. But at the same time, we have to look at the bright side. A lot of people who have gone undiagnosed with PMOS will probably finally get the diagnosis because it's not going to be about the cysts anymore, which is amazing. I am pretty passionate about PMOS because I've had it for so long and I was able to treat it and lose the weight I was able to treat it and lose weight with a lifestyle change. And I will die on this hill that if you have PMOS and you are stuck being fat and you're not on a ketogenic or a low carb diet, that will be the magic bullet for you if you're not willing to try a GLP-1 medication. That's just facts, you guys. It works. It really does work. It is a metabolic issue, and the best way to treat that is hormonally, and if the best way to treat a hormonal disorder is with your diet and your lifestyle. So treat it in the way, like, it honestly, it's basically, it feels like math to me now. It feels like math to me now. I'm insulin resistant. What should I do about that? Oh, I'll just eat the foods that don't cause a large insulin spike, which are fat and protein. This isn't a low carb channel. I want people to have a variety of whatever they want to do. But when it comes to PCOS, I am 100% a go ketogenic, and your life will be changed. Your life will be changed. But yes, I hope you guys enjoyed the episode. Sorry, this one's like super duper long. I'm gonna have to cut out a shit ton. But I hope you guys enjoyed it. Let me know what you guys think in the comments. Let's have a discussion below. When you found out about the name change, was it a shock to you, or were you already one of those people that was like, it was already metabolic? The only thing the only plus that I see is that more people will finally get the diagnosis that they need to, and then that'll help lead them in the direction of treatment and getting in control of their health. And health is wealth, you guys. So if you made it all the way to the end, please leave a avocado in the comments below to spread the awareness that a ketogenic diet or a low carb diet will help those suffering with PCOS control their symptoms. Again, don't forget to subscribe, leave a like, and hype the video if it's giving you the option to hype. And if you're not a member, see the link below, become a member, and get an extra video every week. It's only $2 a month. Make you holla, and me will really appreciate you. Hope you guys have a wonderful rest of the week. I will see you this Friday. If not, goodbye.
Last day I knew you were my pet. I wanna tell you that I love you.